The age of personalised medicine has arrived. Be sure to check out our new FX Medicine podcast series, FX Omics with Dr Mark Donoghue. Explore the genomic landscape and the clinical opportunities enabling you to offer truly personalised healthcare. This is FX Medicine. I'm Andrew Whitfield Cook. Joining us on the line today is Dr Mike Armour, who joined NICM in 2016 as a postdoctoral research fellow working in the area of women's health. Mike's background is a mixture of Western and Eastern medicine, having completed an honours degree in biomedicine before training as a traditional Chinese medicine practitioner. Mike's research areas include gynaecology, pregnancy and fertility, and traditional Chinese medicine. He's experienced in implementing research projects across international borders and has a specific interest in dysmenorrhea and chronic pelvic pain. Welcome to FX Medicine. Mike, how are you?
I'm not too bad, Andrew. Thanks. How are you?
I'm good, thank you. I'm going to leave all of the Kiwi jokes out of our podcast.
Oh, that's very un-Australian of you. Like you're really letting the country down.
So with regards to the podcast topic, research in endometriosis, it's really making news at the moment, particularly I saw last night in the medical news. But I want to delve a little bit back into your history. You said that you did biomedical science, so biomed sci, and then TCM. Why search further than medicine?
Well, I really enjoyed. So I was a cardiovascular biophysicist, which sounds much smarter and more exciting than it actually was. It was great. I really enjoyed it. I really enjoyed being a physiologist, and I was working for the medical school in Auckland, and doing a lot of preclinical research in rats. And it was just, I guess it was actually a combination of things. I was quite. I missed the human contact. Rats, very good research subjects, very compliant, not particularly great conversationalists. What actually happened was I got a frozen shoulder. I'd been sitting in front of a computer a lot, the way our very expensive and fancy microscope was set up. I was spending, obviously, like a lot of researchers, many hours a day in front of that, and I got a frozen shoulder. And it was just driving me nuts. I couldn't sleep. It was hard to work. And so at that time, I was also living right next to the med school, and I walked down the road and into the city, and saw there was a Chinese medicine practitioner, an acupuncturist there, and I thought, I'll give it a go. I've got nothing to lose. I'd always been quite interested in kind of, I guess, integrative medicine, alternative medicine, whatever you want to call it. Anyway, I went in there and it was an interesting experience because he spoke very little English and I speak still no Mandarin.
Yeah.
He basically just went to town on me. Acupuncture, cupping, heat packs, the works of, kind of a traditional Chinese medicine practitioner. And afterwards I came out and I was like, that feels a lot better. And I guess it got me at a time where I was just a bit, I was really missing that human contact. And so I decided to find out if I could study acupuncture. And it turned out there was an acupuncture college very close to there. And so I thought about it a lot and decided, it was either that or, it had already been kind of decided that I'd start my PhD in physiology. And then I thought, do I really want to spend years and years doing something when I already know that I am not satisfied? And so that's what happened. I told my supervisors. They were suitably
unimpressed.
Horrified. Yes. Unimpressed would quite an understatement. Understandably, physiologists, especially kind of biophysicists, it's very quantitative, very data heavy kind of science, and obviously, the idea of someone leaving that to acupuncture was just blew their mind. So, but that was fine. And so, yeah, I left. So then I left and decided to study Chinese medicine.
And so when did you come across to Australia? What was the draw to Australia then?
Well, what happened was I obviously, while I was studying Chinese medicine, I still really enjoyed the research side of things. So I worked as a research assistant in a hospital while I was studying. And when I graduated, I went into clinical practice with a couple of my very, very good friends and really enjoyed that. But I was always really interested in research. I was still like, well, okay, this is good and we're getting these good results, but how do we know? How do we know what's going on? How do we know what's working? And so it just happened that another friend of mine, who's now Dr. Deborah Betts, mentioned to me that she was starting her PhD with a professor in Australia, and, why didn't I kind of join the fun? And so I contacted Professor Caroline Smith and said, I live in New Zealand, but I'd like to study, and she was like, yeah, if you can get a scholarship, come and talk to me again. So what happened was I did my PhD while I was living in New Zealand, but through an Australian university. So thank you, Australian government, for your very generous scholarship. And then when I finished, I decided I wanted to pursue this. And it just so happened that the day after my graduation, a role opened up in my area at Nickham. And so I interviewed for that, and I was fortunate enough to get the position. And obviously, that required, a jump across the ditch.
For our international listeners, the ditch is the gap of ocean at the Tasman Sea, which divides Australia and New Zealand.
Yeah, where the land bridge used to be, but not as anymore.
Not as anymore.
For the American listeners, yeah, we used to have a land bridge and would commute. So at least that's what I've met a few people who believe that.
Yeah.
So anyway, my wife and I made the move in August 2016. So I've been here just over a couple of years.
Gotcha. And what got you interested in women's health research when you're a man?
Yeah, this is always a good party conversation. It was actually a couple of things. At the very beginning of when I started studying acupuncture, I met my then girlfriend, now wife, and she had very, very bad period pain, and I was and I still am very, I guess I think biomedicine, orthodox medicine, Western medicine, whatever term you want to call it, is fantastic. And so I said, well, don't worry, we'll go to the doctor and they'll be able to sort you out. And so I went there, and we went there together, and there wasn't a lot of options that she was given. It was kind of the contraceptive pill, which she was already on, and kind of non-steroidal anti-inflammatories, ibuprofen, or a combination of ibuprofen and Panadol. And that was kind of it. And I was actually like, wow, that's a bit crap, isn't it, really? Like, I thought there'd be something more. And obviously she tried that, and still really severe pain. And so that just, I guess, that kind of lodged in my mind. And then when I was studying acupuncture, when I was a student clinician, if you ever want a thorough examination, go to a student, whether a student doctor or student osteopath, or acupuncturist, anyone. We have to ask all the questions, even if they're unrelated. So we'd often ask all women who came into the clinic, whether it was anything to do with, whether they had a sprained ankle, a sore back, headaches, about their menstrual cycle. And what I was really surprised with was, we'd say, how's your menstrual cycle? And they'd say normal. And then we delve a bit deeper because we had to, otherwise our tutors would be, rather displeased with us. And I was seeing all of these things, pain, irregularity, mood swings. I was like, I don't know whether I'd class that as normal. And then in the course of treatment, I'd often, we'd include some points which in acupuncture might be, considered to be, pain relieving or reducing menstrual symptoms. And often at the end they'd report, oh yeah, my periods have been a bit better. So that just kind of set the seed in my mind of, firstly, it seems like acupuncture can be effective at treating this kind of thing. And also, why are we not treating more of it? Why are women not coming in requesting, treatment for period pain? So that's really how I got started.
This is something that comes up time and time again, and it's just because something is common doesn't mean that it's normal. And it seems so, this is so poignant in regards to women's health and women's health complaints. Can I ask you, Mike, what are the biggest challenges in researching complementary medicines, given that you're, orthodox trained?
Well, there's probably a couple. The two main ones that come across in my mind a lot are funding. So obviously, especially for things like acupuncture, really, who's going to fund it? Because, needle manufacturers, obviously, it's huge money that we, need to do proper research for them. And then there's nothing special about any particular needles, really. So why would they, sink hundreds of thousands of dollars into it when, that it could be any needle. So it's not going to translate necessarily into more sales for them. So funding for acupuncture especially, because there's, you need to rely on really for, government grants and things like that, because, there's not a commercial interest really. So that makes it very difficult to be able to do good quality research, because good quality research is not only about design, but unfortunately it's also expensive, because you need significant numbers a lot of the time. You need good follow-up. You need really, if possible, good database systems to capture everything and make sure you're compliant. So that's one major issue. The other major and probably even more difficult issue is most complementary, alternative, or whatever you'd like to call it, would be what we call a complex intervention. That makes it much more difficult. So, when you're wanting to test, say, if we're wanting to test a pill for period pain, that's, relatively straightforward. We take our active ingredient, we create a placebo which looks identical, maybe both little blue or red, green, yellow, white pills. We screen our participants first. They then go to see, their doctor or whoever's, dispensing the medication. They are, randomized, they're given their treatment, and then we follow them up. So it's relatively simple, because what we're doing is we're looking at really the effect just of the medication. And it's quite easy to tease apart the non-specific effects from the placebo and being part of a study, from the active ingredients. Whereas if you compare that to something like an acupuncture trial, you've got so many different components. It's not just the needling. So the person comes in, they, will meet their acupuncturist. They'll be discussing, usually, they'll have a history taken, they'll get a diagnosis, they may get points specific to that diagnosis, they may be standardized, but there's a lot of interaction that goes on. There's a lot of, dialogue, creating like that therapeutic alliance.
Right.
Then you've got the acupuncture itself, which is obviously, quite an unusual treatment. And it's also very hard to create, a good placebo for that. And then, so you've got so many different components. And in clinical practice, someone seeing an acupuncturist might get herbal medicine, they might get diet and lifestyle advice, they might get moxibustion, which is like a warming stick therapy. So many different things that they'll get. So it's really hard for us to control for all of those factors and to tease out what are the active components when we're delivering a therapy. How do we control for those? What do we need to, is it the needles? Mm-hmm. How much of a part do the needles play versus how much a part does the overall interaction with, traditional Chinese medicine or acupuncturist or whoever play?
Yeah, that's really interesting. You know what? That's totally awakened me, because I never, ever thought about the therapeutic intervention of the consultation as being a variable to a confounder.
Absolutely.
Of the research.
So there's a guy that his name is Engel, and he wrote in a textbook in 1988. It was I'm a big fan of this guy. He coined a term, well, we call it Engel's double need. And it talks about what patients need. So they need to be known and understood, and to know and understand. So those are their two needs. So basically, they need to be heard by their practitioner. They need to be validated. They need to be able to talk about their symptoms, their medical history, and they need someone to go, yeah, okay, right. I'm hearing you. I'm listening to you. And then they need to know and understand. So they need to then, what they really want is an explanation of what's going on. Why have they got this problem? Period pain, for example. And they need to understand. And I think, acupuncture, just as an example, consultations meet those needs for people because, the complex Chinese medicine history taking does provide that ability to be heard and understood. And the explanations that are often given, while they're not the same as the biomedical explanations, are given to people. Most practitioners will explain, well, this is what I think is going on in terms of Chinese medicine. Compare that to, most women's experience with their general practitioners. When we talk to them about, what causes their period pain, most of them, have been told that they've got period pain. It's very normal. Don't worry about it. You'll grow out of it. But very few have ever been told, well, this is why, we think it's probably too much prostaglandins or this or that. So it's, I think that the difference in consultation is a huge, it is a really significant factor. And the interviews that we did with our participants after the clinical trial, that came up again and again. The therapeutic alliance was so important. They felt listened to. Someone was finally taking them seriously.
Yeah.
So we can't underestimate how important that is to people, and especially, I think, to women who often seem to have their pain minimized, belittled, not believed.
Yeah, that's right. Can I ask, though, wouldn't that also be a confounder for orthodox medicine, for pharmacological intervention? Because they're still going to have those as an ethical consideration. You've still got to have a consult and regular follow-ups. So is that part of the confounders that they have to allow for?
It could be, but a lot of the time what happens in orthodox trials is the screening will be done prior to any interaction with the doctor or whoever's dispensing the medication. So there's not always the same level of explanation and interaction that there would be. Time is another factor, so when people are, being involved in complementary medicine clinical trials, they're often spending a lot of time with the therapist, 45, 60 minutes. So I think we need to take that into account as well. But absolutely, there is always going to be that confounding factor, whether it's a complementary medicine trial, whether it's an orthodox medicine trial. I think it's just likely to be a greater impact in complementary medicine because of the fact that the consultations are longer.
Yeah.
They do involve more components.
And with regards to, I guess, part of the TCM repertoire or armamentarium, acupuncture, I need to ask a question about, and this is something that various people will tell me different things. So does it affect the opioid receptor or not, or both?
So as far as I know, the current research suggests there's a multiple pathways.
Gotcha.
It does. The last time I've read the research, which wasn't that long ago, it does seem like it increases the endogenous opioid mechanism, so it does dump endogenous opioids.
Mm-hmm.
And we've seen that when experiments where there's pain relief which is occurring, and then now
can be reversed with Narcan. Is that
that's the one?
Yep.
Yeah. And we know sensory nerves are involved because that will also it stops any effects if sensory nerves are blocked or cut.
Forgive me, I should have been generic then for our overseas listeners. It's Narcan in Australia, but overseas, if we go to the generic name of the drug, it's naloxone. Yeah.
I think that's at least part of it. For menstrual pain, we think there's other impacts. It seems like there's probably an increase in blood flow to the uterus through increasing perfusion through the uterine arterioles, and that's probably through the needling of a point called spleen 6, on the inside of the calf. And it seems like there's it operates via sympathetic reflex inhibition. So needling that point seems to increase blood flow to the uterus. And there's been some experiments, some research done by Elizabeth Steiner-Victorin over the last 15 years or so looking at that. And that is and reduced blood flow to the uterus is a very significant contributor to period pain.
So this might answer, at least in part, why acupuncture might be worthwhile in mood disorders, for instance, with the vagus nerve. Is that right?
Yes.
Is that where we're going?
Yeah. Yeah, and also a lot of mood disorders, especially if they're related to menstruation, seem to be through increased inflammation. And so there is evidence that acupuncture reduces inflammatory markers such as interleukin 6. And there's a lot of sixes in this, isn't there, really? It's almost designed to cause an international incident. So we think that there was a really interesting paper maybe 18 months ago in the Journal of Women's Health where they looked at women with PMS and found that they did have, the symptoms were correlated quite strongly with increases in interleukin 6 levels. So, and we also, so we think that there's increased inflammatory markers, could be reduced by acupuncture, and that might also explain why acupuncture can be effective in treating premenstrual syndrome.
And I guess one of the other things that I'm interested in is when we're talking about research of TCM, but we're talking about it in the Australian landscape, we are lucky enough to have the TGA as our warden, if you like, of quality, but it can be a real issue with overseas research because of adulteration and contamination, heavy metals, etc. Even drugs are in there. There's a few drugs, a few major culprits that are found and they very often leak into Australia with internet purchases. So I guess the warning to people is don't buy over the internet, particularly with TCM, if you don't know where the herbal manufacturing is going on. But what about these herbal quality issues when you're dealing with a multitude of herbs in a formula? How do you sort of control the confounders there? Do you talk to how they have like Beplurum 6 minor Beplurum complex is a standard formula? Is that how you control the confounding of the multiple herbs in there?
It sounds like you're talking about safety in some ways, and definitely, like you said, patent, what's called patent medicines. It's definitely, the quality is dubious, and like you say, the adulterants, can be present, and that's really concerning. Especially when you're looking at some formulas where they're, like for erectile dysfunction. There's obviously traditional Chinese medicine formulas for erectile dysfunction, but then when you're popping things like sildenafil in there without disclosing it, and obviously the patent formula is working. Because it has sildenafil in there. But, you don't know that that's what you're taking. So huge safety issues with interactions and things like that. And obviously just, deception, because, you're taking a pharmaceutical medication without realizing it. So I think, I personally think that, I would always, from my own personal point of view, use formulas which were created, in Australia or in countries where there's, tight GCP, good, GMP, in this case, oversight. So there's, certain formulas and products that I would feel very comfortable using, and then personally patent formulas, from mainland China, I do avoid because I don't know what's in there, and that does concern me.
There are some extremely competent ethical manufacturers in China, and we're certainly not denigrating all of the manufacturers. There are some incredible companies over there, but the problem is there are those that aren't and that leak through. And so it's really hard to judge unless they've got the okay of the TGA in Australia.
Absolutely. And obviously, looking for, the GMP, that they're being produced in GMP certified factories. But I think it's just, like you say, it is a real issue because, you don't want to tarnish, everyone's herbs because of those people who break the guidelines. But it's also, I think it's just something that people need to think about whether, if they're concerned about risk, is there an alternative, where they can, get a similar or the same formula from another source where they, perhaps there's more that, they can be more sure of the oversight.
Now, delving into our topic today, and that's pelvic pain and endometriosis. Endometriosis is finally reaching the headlines. It's finally getting the news that it deserves to awaken people to the issues that women face with this treatment that doesn't just reside in the uterus. And it's trivialised so often. Let's talk about that, the role of integrative medicine in treating pelvic pain and endometriosis.
Yeah, absolutely. Well, look, we're still in relatively early stages of investigating a lot of complementary or integrative medicines and treating endometriosis. But there's a couple of really interesting things that are happening at the moment. And a lot of it is, just going to toot my own trumpet a little bit about some of the work that we've been doing. So we're just in the process of publishing a survey that we did about a year ago, actually, where we asked women with endometriosis in Australia what kind of self-management strategies they used. And this was anything basically non-pharmacological, I suppose, something that they could do or acquire themselves. So we asked them about yoga, exercise, rest, meditation, and based on some anecdotal evidence that we really heard from other projects like Citizen Endo, which is a great project that's running, collecting data via an app on a smartphone. They published their kind of interim results, and we looked at that, and we also found that when we're using alcohol and cannabis or CBD oil as well, in terms of managing their symptoms. So one thing we do know, women with endometriosis in general, they have a really tough time managing pain. Obviously, pain is probably the major symptom, that women with endometriosis have, and that's everything from very severe period pain to what we call non-cyclical pelvic pain, which is just a fancy way of saying it's like period pain, but you don't have your period. And a lot of women have that at least several times a week. Some may have it every day. Pain on sexual intercourse, incredibly common, and same with pain on bowel motions or with a full bladder. So pain, pain comes up again. And obviously untreated pain has really catastrophic effects on mental health, on, work, social life, pretty much everything. And it's a struggle for women to manage their pain because certain medications like endone, so that's OxyContin, can be really effective. But it's often, there's women are concerned with addiction. And what we hear from the women who've been in our focus groups is that it's often a Hobson's choice for them. So they either sit with pain at work and are able to do things like pick up their children and do other things, driving and things like that, or they take the medication which relieves their pain, but then they're limited in some of the other things they can do, such as looking after their children or picking up their children. So it's a horrible decision that they have to make. So women are definitely looking for adjunct pain relief. So something they can take on top of, say, ibuprofen or Panadol or something to help improve their pain control. So what we found from our study was there's a very small number, a relatively small number of women were using cannabis. It was about 13%, which is, while it's small, it's also high, no pun intended, because, cannabis is currently illegal in Australia for, you can't easily access it, that we know of for pelvic pain.
Don't get me started.
Yeah. So, but these women were reporting very, very high levels of satisfaction at pain relief, much higher than any other of the other interventions. They were also, really importantly, reporting a reduction in their medication that they needed. So I think it was about 52% of women taking or using cannabis reported a 50% or greater reduction in their endometriosis-related medication. So the caveats to this are obviously very small number, and we didn't ask them specifically what medication they were reducing.
Right.
The implication is obviously it's pain-related medication, but we can't be certain.
I see. Right.
So we need to do some follow-up work on that. But they were able to reduce medication that they were taking specifically for endometriosis by 50% or more.
It's a fair guess. Can I ask just for a bit of clarification?
Sure.
Hobson's choice, that's the take it or leave it, is that right?
Hobson's choice is it's a choice where it looks like you have a choice, but you don't.
You don't,
really.
yeah.
So, it seems like you've got a free will, but you don't. So, for a lot of these women, they don't have the choice to take the pain relief because they might need to go and pick their children up from school. And they don't want to risk, taking something which might impair their ability to drive. So, to give you an example, one of the women in our focus group said, she puts up with pain all day, and then she goes and picks up her daughter, I think it was, from school, gets home, and basically as she's walking in the door, she's chugging down the
codeine-based,
so she can finally get relief.
Which would rob her, obviously, of family time and things like that in certain situations.
Absolutely. And then she says, well, I go to bed, basically.
Yeah.
I'm exhausted from the pain. Then the painkiller kicks in, and, there might be some sedative effects of that.
Yeah.
Absolutely. She says, my husband's amazing. He has to basically, we kind of I just tag out. And so there's huge impact on women's lives. So that was one of the really interesting findings from our study. The other one was just around exercise. Obviously, there's huge public health messaging at the moment about the benefits, the very real benefits of exercise.
Yep.
Not just for getting beach body ready, but mental health. I think this, and my colleague, Dr. Joe Firth, has published like 1 million meta-analyses now on it's probably pretty close to that, on exercise and depression, schizophrenia, all kinds of mental illness. And I think, there's some pretty solid evidence that exercise is beneficial. What we found was women with endometriosis often reported exercise made them feel worse. And again, we didn't collect exactly the type of exercise, so it's just a broad category. But there was a high rate of adverse events, and they reported that they felt exhausted, because obviously fatigue is another very, very common symptom of endometriosis, which is just gaining more recognition now. So they were exhausted, and they had what they call flare-ups. So very common term in the endometriosis community. So it basically means their symptoms, especially their pelvic symptoms, just got worse, much worse for a short period of time. And so, there's difficulty there because, women are wanting to, get the benefits of exercise, stress and, depression and anxiety, which are very, very common in women with endometriosis. But when they're trying to do that, they're kind of getting thwarted a little bit because it's often causing increased pain. So there's a lot of frustration there. So we think that, probably the best idea would be, that there's more resources for women with endometriosis in terms of exercise, getting some oversight or supervision by someone who's trained to be able to kind of slowly grade up that exercise rather than jumping straight into something like
that. Happens in a multitude of conditions, the weekend warrior type thing.
Absolutely. And I think it's just, this is psychologically quite hard, could be very tough. I'm trying to do something for my health, but my endometriosis is thwarting me again. So I think, exercise could be great, but it probably needs to be done under the supervision of someone, who can kind of prescribe exercise rather than being like, I'm going to go and do an 8-week boot camp, or I'm going to, start CrossFit, or, and then, you're getting this kind of flare up.
What about certain types of exercise? Like, we're learning from the exercise physiologists at, God, I hope I get this right, Curtin University in Perth, that certain types of exercise or varying types of exercise benefit varying types of cancer therapy.
Yes.
So protective against, say, prostate cancer was jumping. To maintain bone density. I'm a big fan of dad dancing, but were there certain types of exercises that didn't have the flare ups at all?
We don't know. Unfortunately, that was a shortcoming. It was a very large questionnaire, so we tried to make it as broad as we could. So we really just had exercise as exercise.
Yeah.
We did get some indication that yoga, we asked that as a separate question. We did get some, and we asked a lot of free text as well. We gave women the opportunity to talk about it, different things. And we found that yoga, there was definitely a positive trend towards yoga being beneficial. And it could, again, just be that slower, more graded movement. So when you've got, adhesions and things like that, it's possible that that kind of slow stretching is beneficial, where, perhaps jumping or high impact exercise may not be, because of, the structural component.
And what about any biochemical measurement with the exercise? Is that, obviously this is early days, but has anybody looked at this? Like you were talking about, inhibition of interleukin-6 with acupuncture. Has anybody looked at inhibition of inflammatory markers with varying types of exercise?
That's a good question. I actually don't know. I did read something recently, but not recently and well enough that I would comment on it. But there was some. I think there's some conflicting research. What I remember, this particular paper was contesting the idea that exercise has an anti-inflammatory effect.
Right, gotcha.
So I don't know, and it's certainly no one, as far as I know, has really looked at exercise in women with endometriosis in a prospective kind of way. So there's been some retrospective studies where they've looked at, I guess, trying to tease out what might cause endometriosis, and I think they looked at, was exercise either a lack of or too much,
a trigger for it.
A trigger for it, but
or a driver.
It doesn't seem that way. And also, I think it's really, there's so many different factors that, I'm quite cautious about using, that kind of epidemiological data,
right.
Unless you've really captured all the other possible components. But as far as I know, there was no link between endometriosis and exercise.
Yeah.
What would be really interesting is to look at, the effect of exercise, of different types of exercise on endometriosis in a kind of like a randomized controlled trial.
Structured way.
Structured way, absolutely.
And measuring inflammatory markers. That'd be interesting.
Absolutely.
But I think there was also some, I think you used the word contested, there was also some argument as to what inflammatory markers were more appropriate to measure, weren't there?
There's absolutely no consensus at the moment on inflammatory markers for endometriosis. Obviously, the holy grail is an inflammatory marker or some kind of marker which allows accurate detection of endometriosis without a laparoscopy.
Yeah.
I think there was a Cochrane review on this just a few months ago.
Yeah.
And unfortunately, at the moment, still nothing.
Yeah.
So, because that's obviously, that would be amazing. Because one of the major issues is, there's no diagnosis really for most women of endometriosis without a laparoscopy. They can have suspected endometriosis, but most doctors won't say they definitely have it without a laparoscopy. And it's certainly a current research standard that's the gold standard. You must have a laparoscopy diagnosis. And that's obviously invasive and not to be taken lightly. And most, doctors can be quite reluctant to go down that route.
And should be done by somebody suitably trained, like a Cree expert.
Absolutely. And so, having a non-invasive, like from a blood test would just be fantastic and would allow much easier screening of women who've got symptoms suggestive of endometriosis.
Yeah. Just going back to herbs a little bit, when we're talking about TCM, what about some Western herbs? Forgive me, you were also including the THC and CBD use.
Yes.
Firstly, THC and CBD versus opioids. Has anybody looked at that with regards to benefit, less adverse effects or side effects, more compliance, greater acceptance? Anybody looked at that?
I'd say that's more Justin Sinclair's area than mine. I do believe that there has been, there is research to suggest harm minimization, substitution effect, so that people are actively substituting cannabis or CBD oil for their opioid-based medications. But again, there's, the research is quite contentious because there's been a lot of trials, not all of them well designed. So you've got issues with, the strains, with dosage, with outcome measures. So that always makes it a lot more difficult to determine.
Yeah. What about some Western herbs? Anybody looked at, curcumin is very commonly used, for instance. Then you've got other ones like Jamaican dogwood and California poppy. There was a herb that I used to employ, not for endometriosis, but for other chronic pain years ago, but it was always an S4, that is prescribed herb, and that was gelsemium. I had a very understanding doctor that I used to consult with. And that was the herb gelsemium, not the homeopathic remedy gelsemium. I was blessed with being able to use some of these herbs. But overseas, like in Germany, these are often employed. What's our knowledge of the use of these herbs at this stage?
I think there's very little on Western herbs that I know of for treatment of endometriosis. There's some research on Vitex, but that's mostly around premenstrual syndromes rather than endometriosis-related pain.
Yeah.
I'd say the most research is actually on traditional Chinese medicine formulas, and one formula in particular, which is, excuse my terrible pronunciation, Guizhi Fuling 1. So that is GUI space ZHI space FU space LING space WAN. And WAN just means pills, so it could be Guizhi Fuling San, Guizhi Fuling Tang, depending on how it's taken.
Yeah.
And it's cinnamon and poria twig decoction.
Right.
And that's the most commonly used traditional Chinese medicine for endometriosis. There's some survey data out there from Taiwan, I believe it is, where that was overwhelmingly the most common formula used. And that seems to be quite promising. Now, most of the research, unfortunately, is not particularly high quality, and it hasn't been published in English language journals. But it certainly seems like from the research that's out there, it could be very promising. And we are about to undertake a clinical trial looking at a slightly modified Guizhi Fuling 1 formulation for the treatment of endometriosis.
Gotcha.
And we'll be starting that in 2019.
Great.
Yeah, so that'll be
say no more. You can't say any more.
So we'll but I think that's probably the most promising traditional Chinese medicine formula we have at the moment. And I think that herbal medicine has such a possible role that could be played. But like you mentioned earlier, endometriosis is just coming out of the shadows, if you like. So unfortunately, there hasn't been a lot of research funding for endometriosis. So, in Australia, for example, there is now through the National Action Plan, there's going to be specific funds for endometriosis. But if we go back a couple of years to 2016, the amount that endometriosis got was 2.8% of the amount that diabetes got.
Yeah.
despite the fact that in terms of cost of illness burden and impact on life, incredibly similar. So
Wow.
I'm really hoping that, some researchers, Australia or anywhere in the world, do look at, properly designed clinical trials for herbal medicine for endometriosis, because women do want alternatives. They do want adjuncts. They do want something to help control their pain where, hopefully there is less risk of addiction, less side effects.
Yeah, being able to function, yeah.
Being able to function, absolutely. It shouldn't be a choice between being in pain and being kind of, compos mentis. So I think it will be a great place for researchers to look. And there might be some trials going on at the moment. Obviously, that's one of the problems we have in research is that, it's years between conception, execution and publication.
Yeah. I've got to say, I'm so glad in Australia we've got these great research institutions, integrative medicine research institutions, like where you're working. You've got the Jacker Foundation, you've got NIM in Melbourne, you've got Endeavour College and UTS, and with these great research areas in Australia that are really looking seriously, scientifically, at integrative medicine, adjuncts, alternatives, options, in a responsible way. Like, for instance, with existing medications and with, reasonable populations that we're going to work with rather than quote unquote well people.
Yes.
That sort of thing. I've got to say, Australia really is at the forefront of so many areas of research, thankfully, in women's health issues as well, like polycystic ovarian syndrome, and endometriosis is coming up now, thankfully. It's just so great to see this finally, as you say, come out of the shadows.
Yeah, absolutely. And as much as it pains me to say it, you are right. Australia is, Australia's doing fantastically well, and all of those institutes, we collaborate with a lot of them, and, it's really high quality research, which is what needs to be done. We need to have research institutes who are doing, even, whether it's government funded or commercially funded research independently, and, looking at, sensible outcome measures, sensible research designs, so we can really have a good look at what place integrative medicine, what role it plays, without, overstating the case, but also without being, without dismissing things, without looking at them first.
That's right. So, this is something that always plays on my mind, and that is, just because there's no evidence against it doesn't mean there's automatically evidence for it. I get it. I get that responsible thing. We can't overclaim. Yep. But for goodness sake, where there's real need, where people are in pain, where people aren't well treated by orthodox options, we should responsibly, ethically, be seriously looking at scientific options in the integrative sphere. And that includes exercise and lifestyle and diet. I get that, but we really, really need to have some serious investigation into these, alternative therapies, which include TCM and herbal options as well.
Yeah, absolutely. And like you say, we have a population with women with endometriosis, are a population which do not have good pain control. It impacts every single aspect of their life, from their work, their social lives, their friendships, their romantic and sexual relationships. If there's a cure that comes out and like herbal medicine and acupuncture is no longer needed, that would be great. That would be absolutely. I would be the first person to celebrate that, but we don't have that at the moment. I hope we have that in the future. But in the meantime, we need to think about the women who are living with this. And that's the ethical thing to do. I agree. We need to say, okay, so we want a cure. Absolutely. We need to fund research into that. We need to fund that without a question. But we also need to fund research into, if we find a cure tomorrow, let's be realistic, it's going to be 10 years before, it gets through trials and approvals and things. So we need to think, okay, so for those next 10 years, how are women going to, live on a day-to-day basis. So, that's kind of my thinking.
Hear, hear, Dr. Mike Armour. Thank you so much for your wise words and opening up this sphere of research in, including TCM and acupuncture and things like that into women with gynecological issues. I really admire your research. As a man, I might say, it doesn't preclude us caring. Well done to you.
Yeah, absolutely not. And I think that's, men should care. We, all of us, just as humans, we should care about, other people. And when you think about it from a practical point of view, everyone's got a mum. Most of us have sisters, cousins, aunties. The chance of them being affected, someone you love being affected by, a woman's health condition like endometriosis or even just period pain, it's so high. And it's not a woman's problem. It's a
community. It's a societal problem. That's right.
Absolutely. And we need to think about it like that rather than just secret women's business. That they need to fix. And I think probably I haven't heard Lara's podcast with you, but I'm sure she probably said the same thing. It's a taboo topic. That's why it's one of the huge problems. I often say that I can't talk about my research at the dinner table because, it's kind of considered to be shameful, dirty, sexual, taboo, something. And I think that's a huge part of the problem that we, 50% of the population, menstruates and it can't be talked about.
Well done, Mike. Thank you so much for taking us through these issues today on FX Medicine.
No worries. Thanks very much for having me, Andrew.
This is FX Medicine. I'm Andrew Whitfield Cook. Registrations are now open for the 7th Bioceuticals Research Symposium to be held in Sydney from the 3rd to the 5th of May 2019. To register, please go to bioceuticals.com.au and click on the Education tab.